back to my channel. Welcome if you're new here for another month. I was gonna say for another month, my name is Yusra. My name is Yusra always, but for another month, I am a third-year student at Duke's Doctor of Physical Therapy program. I am so self-conscious recording myself right now because I know my sister is in the other room and she can probably hear everything that I'm saying and she's probably making fun of me and she's probably recording me right now. So that's terrifying. Today I wanted to bring you a third-year wrap-up clinical rotation summary video. I've blogged here and there throughout my rotations about how it's going, what I'm doing, but I've never sat down and done like an entire here's how it went, here's where I was, and here's what I learned. So that's what we're doing today. I'm gonna try to keep it brief and I'll probably try to do multiple videos like this, mostly because that way there's not a ton of pressure on me to get everything into this video, and then that way if I forget something, I can just put it in the next video. And most importantly, I haven't had my coffee yet, so I wanna get this done so that I can go downstairs and make myself some coffee. Okay, let's just jump right into it. My rotations. So I had 3 12-week rotations. So the way Duke does their clinical rotations is we have short-term rotations in our first and second years. Those are either 1 or 2 weeks long. In our first year, we do either an outpatient or an inpatient rotation. And then our second year, it flips. So for example, for my first year, we did 3 short-term rotations and I was in an outpatient orthopedic clinical. That was at, I can't remember exactly what it's called, but it's like Duke Outpatient, Duke Physical Therapy, something of Knightdale, North Carolina. So it was in Knightdale. It was about 45 minutes from my program, which really wasn't a bad drive. I really liked having that time to listen to podcasts and to just sort of reflect on the day afterwards. Those rotations, all the short-term ones, are all done in teams. So we keep the same team for the entire first 2 years. So I was in a team with 3 of my really good friends. I had a fantastic team, really funny group, and very intelligent group. So I learned a ton from them. And what I really loved about being in that team was, even though everyone was super smart, and if we got asked a question that was really difficult and I didn't know the answer, yes, I was able to kind of rely on them for the answer, but I also learned a ton, and I never felt like I was just kind of sitting back and letting them do everything. I felt like it was a group in which I was really comfortable taking initiative and being a leader when I needed to be, especially when our clinical instructor would be like, okay, you're lead PT for this one. There was not a single person in my group that I wasn't totally confident in and comfortable with being my secondary PT. That was always really fun when we got to do those scenarios because I knew that I wasn't alone and I knew that somebody was there to have my back in addition to my clinical instructor, but it was also a time for me to kind of showcase my skills and what I had learned. So yeah, so Knightdale for my first one, that was outpatient orthopedics. We did a 1-week rotation in, I think November. Then in the spring, we did a 2-week rotation there. And then in the summer, we did a 1 week, or I think I said that wrong. I think we maybe did 2 1 weeks and 2 weeks over the summer. I really don't remember, but I do believe it was 4 weeks in total. Might have been 5. I should have looked that up before I did this. In my defense, I was only thinking about long-term clinical rotation, so this is all on the fly. We did that, and then in my second year, I did 2 short-term rotations in the same location with the same team, with the same CI. So I was in the cardiothoracic step-down unit at Duke Hospital. What was really great about that was there was no long commute, but we did have to walk. So it was like a 20-minute walk, maybe a little bit less actually, from our PT program to the hospital. Not bad at all, even on the days when it rained a ton, which was all the time for some reason during our short-term rotations. It was honestly never a problem. And again, I was with that same team. And so a lot of times we would meet up really early in the morning at our PT program and then walk together. So that was really fun. And then I had also started listening to a bunch of new podcasts at that time. So when my teammates weren't there to walk with me, if either I was running late or they were running late, I would just walk by myself, but then listen to my podcast and have my umbrella and be rained on the entire time, because for some reason, every single time we had these short-term rotations in our first and second year, even though they were interspersed at random times of the semester, it was always the worst weather of the semester. And I remember one time we got let out early from our first rotation to go home because no patients were coming in because the weather was so bad, and it looked like a tornado was brewing right outside the clinic, and the clinic had these really big beautiful windows, and I could not stop staring out the window, and I was not paying attention to my patient at all. Luckily, I was like in the background. It wasn't my patient at the time and I wasn't treating, so I was just kind of shadowing, which thank God, because poor patient, because it was terrifying outside. And I think it was like one patient in the clinic. It was awful. And then I remember I was like so upset and so nervous about driving that I sat in my car for a really long time when it was raining really hard. And then I was like, I'm getting Red Robin. And then I drove to Red Robin for whatever reason because I was obsessed with it, and I still am. And I thought it would make me feel better. And then by the time I got there, the weather was like super nice. So technically I didn't like need it to help my emotions, but then I got it anyway because I really like Red Robin. I think I started talking about my second rotation and then I went back to my first rotation for some reason to talk about weather, but we're just gonna go with it. So for my first rotation, I had 2 different CIs. This is still talking about short-term rotations. So this was in Nightdale. So the first 2 times I think that we did our clinical rotation there as a team, we had 1 CI or clinical instructor, and then for our last one, for our third one there, we had a different clinical instructor. Our first clinical instructor had moved on to a different job, so then we got another physical therapist who'd been there. And that physical therapist had actually been a clinical instructor to one of the, at the time, third years in our program. So that was cool because she got to have like a long-term student from Duke, and then she got to have us little first years. And for her, I'm sure it was a challenge just because going from like a third year's knowledge who's like ready to be entry level and like ready to go treat, and then like first years who have no idea what we're doing and like didn't know what a goniometer was until 2 weeks before that rotation and still haven't learned like manual muscle testing. And at that time we hadn't taken our musculoskeletal class, our MSK class, so we really didn't know what was going on in outpatient ortho. So our clinical instructors did a really good job of trying to introduce us to things that were going to end up being really important but that we had like no idea of at the time, like joint mobilizations. And she was super into manual therapy, so that was really cool because now I'm really into manual therapy, and my long-term rotations were very manual therapy heavy. And so it was cool that that kind of came full circle because at the time as a first year I definitely didn't understand why it was so important and like what we were really doing and like what impact we were really having on the patient. She like definitely tried very hard to get us up to speed without us having taken an ortho-based class yet. And like I had never been a physical therapy tech. I had worked in a hospital but never done any sort of like outpatient work other than just shadowing and volunteering. I don't know if any of my teammates had been techs. Some of them were definitely very much into like exercise science and like weightlifting and stuff, so I think that really helped them, and that was really nice for me because I was able to get a lot of like intervention exercise ideas from my teammates because I was just so like not well versed in that at all. So I'm gonna share my highs and lows for my long-term rotations. I probably won't for my short-term rotations just because I don't remember them quite as specifically, and I also haven't written them down, and like I said, I really need my coffee, so we're just gonna keep going. Okay, so my second short-term rotation was, like I said, at Duke Hospital. It was the cardiothoracic step-down unit, so not patients who were as like critically ill as they would have been in the ICU, which some of my classmates were in. Still patients who were pretty sick and definitely needed physical therapy. That was a rotation where we had patients primarily with cardiac and or pulmonary issues. So a lot of patients post like heart transplant, a lot of patients post coronary artery bypass surgery. We didn't have any patients who'd had stroke. Those patients, I'm assuming, were like more on the neuro floor. That rotation was really, really good. Our clinical instructor was just so awesome. She had been a TA, a teaching assistant for our cardiopulmonary class a bunch of times. And so we already kind of knew her. She was super down to earth, like very chill person, but also just so like passionate about her work and just so loving towards like her students just as much as her patients, just as much as her like coworkers and colleagues. And she just loved her job so much and she just wanted to be there. At least it seemed that way, and it definitely came off that way. It made us really excited about being there, and like she had a ton of confidence in us, so then we felt a ton of confidence in ourselves. I just did a lipstick check and I realized I did have lipstick on one of my teeth, so if you saw it, just ignore it because I'm not going back and recording all of that again. That rotation, we kept the same clinical instructor both rotations. To my knowledge, she still works at the hospital now. Really cool person. She's done multiple residencies in ortho and cardiopulm, so that was really cool because not only did we get to learn a lot about cardiopulm and inpatient, but we also got to bring our ortho knowledge from our first rotation and then her ortho knowledge into that setting, and that was really nice, especially for learning how to like understand what orthoses a patient might need, how to adjust those if they're not working well for those patients. And I'm trying to think exactly who all I treated. Like I said, lots of like patients who had gone through like a cabbage, patient post-transplant, and then I remember one of my teammates had a patient who was an amputee, and then just a lot of patients who, whatever like surgery they had, they just seemed very like deconditioned. For a lot of them, we were just trying to like keep up strength. A lot of like home O2 assessments. So seeing, does this patient need oxygen at home? And if so, like what is their current status and like what might they need? And so that was really cool. I think that was my first solo eval, was a home O2 eval. So I got to eval this entire patient, and that was really interesting because I don't think the patient liked me very much when I first walked in and introduced myself. I, based on my own experiences, could attribute that to a lot of different things. Truth is, like, we'll never know. And it could have just been my sort of like insecurity too, being like, ooh, he doesn't like me. But it was really interesting because I remember I was lead PT, and then a classmate of mine who is a guy was my secondary. And we walked in and I was like taking vitals and asking a lot of questions, and the patient like would not look at me and would only direct his attention to my male counterpart, and would answer like all of his questions to him and like ask him questions. And I loved that my teammate didn't just like jump in and be like, okay, well, like clearly the patient wants to talk to me, so I'm gonna do like the lead part here. He kind of stepped back and he would like smile and be polite, but he let me take control. And that was really important for my confidence in myself and also for the patient's confidence in me. And that was really nice because then we got a conversation going. We were able to connect over college basketball. Turns out we hate the same teams. We got to talking. And so I think that there was a lot of like our past that we were bringing in, because when I first started to help him like get his shoes on and stuff, like he just kind of looked down at me and he was like, what are you? Are you Muslim? But like he said it kind of in like a way that was like, are you an alien? And so that I was like, ooh, this isn't gonna go well. But by the end, we were like joking around, talking basketball, like I said. And I think that session actually went over because we were talking so much. So I have learned a lot about my own biases and how to catch those quicker and quicker and learn to mitigate them, because I think that we all have biases, but it doesn't necessarily mean that we have to act on them. And it doesn't necessarily mean, and it definitely shouldn't mean, that a patient's treatment session is affected by and altered because of it. And it definitely shouldn't be made any like worse because of our biases. Okay, on to long-term rotations, which is what I meant to talk about when I sat down. Like I said, I totally forgot that we even had the short-term rotations until I started talking, but this is good. This is good for me. Slowly getting back into the YouTube thing. Okay, so 3 12-week rotations, and that was our entire third year. So our third year ran from one of the last days in July all the way up until our official like graduation date is going to be May 10th, 2020. So that's however many months. I can't do the math. We did the 3 12-week rotations, and then we also had monthly assignments for our like professional development class. And that was always fine because those assignments never really took that much time. So in the beginning, they were a lot more related to our rotations. So they were like a case study, for example, that we had to do. And then now our most recent one was a portfolio that we had to put together. So it had our resume, our cover letter, our goals for 5 years out, for the first year of practice, for like 10 years out. And so that was really interesting writing those, just because I've realized that like I started writing those goals during my first rotation, and then I revised them this rotation, and then, or like in my last rotation, and then I submitted it. But then even after that, my goals have changed, and it's really interesting to see how much my goals mirror what my CIs are doing. And I think that is a testament to like how amazing my CIs are and what an influence they had on me, but also like how much I just like wanted to be like them. And I think that that really impacted what I thought I wanted for myself. So goals wise, I definitely think that like my goals have changed a little bit, but I think it's more so that they've just kind of like progressed from where I started. My 3 rotations took place in 2 different states. So first I went to Louisville, Kentucky for my first 2 rotations, and then I went to Jacksonville, Florida. If you've noticed, I haven't said any of my CI's names yet, and I'm gonna be keeping them private for my long-term rotations as well, just because I want to respect like my CI's privacy. But I will tell you what locations I was in. Like I said, I went to Louisville, Kentucky first, and I was with a company called Results Physiotherapy. They are the ones that I was talking about that were very manual therapy heavy. I was in an outpatient orthopedic setting for my first rotation. My second rotation was outpatient orthopedics plus pelvic health. And then my third rotation was at Brooks Rehab Main Hospital in Jacksonville, Florida. That was inpatient rehab. My like assignment was primarily patients with spinal cord injury, but I'll get a little bit more into sort of the range of diagnoses that we saw in our patients. So for my first rotation, I was at Results. I was at 2 different locations. So I was at their Jeffersontown clinic first, and then my CI got a promotion, and so then we moved to the Okolona clinic. I loved this rotation. I learned a ton in all of my rotations, but I think that this one holds a special place in my heart just because it was my very first one. For the most part, the diagnoses that I kind of came up with for my patients, or like the major ailments that my patients came to me with, were low back pain. I had a lot of patients with shoulder pain, which I did not have a lot of in my second rotation, which who knows why. I just thought that was interesting. Some patients with like foot pain and plantar fasciitis. I think I had a couple of patients with headaches. I don't think I had a lot. I had a lot more patients with headaches in my second rotation, and it's become my favorite thing to treat. So that's been cool too, to see how that changes over time. And then lots of patients in my first rotation with hip pain. I saw a pretty wide range in terms of ages and demographics in my first rotation. My first rotation compared to my second had a lot more patients who were of like lower socioeconomic status, some of whom had like issues with transportation to physical therapy. I think my CI had more patients who had like issues with access to transportation than I did, just based on like eavesdropping. And so I think that would have been really interesting to try and address for my patients. But unfortunately, I don't think I did a very good job of that in the patients of mine who like were struggling with that. But that is definitely something that I would want to be better about once I'm like established somewhere and working in outpatient orthopedics, and like understand the community a little bit better and like what resources the community has to offer. So my schedule real quick for that rotation, we worked every day, Monday through Friday. We did not work weekends. And then I think Mondays were like our long days. So we had like 7 to 6. And then Tuesday, Thursday were like 9:30 to 6:30. And then Wednesday we had a half day. So it was like 7 to 1. And then Friday was like 7 to like 4:30, something like that. I'm close. I'm pretty close. And then during that time, what Results does that I think is super cool is they offer weekly tutorials. So that is for their like newer clinicians. So not necessarily new grads. So I've met some clinicians who worked in other settings for a couple of years and then moved to outpatient ortho. And so they were also involved in the tutorial process. I just got distracted by a text message. My sister told me to come to her room. Hold on. She was napping with our cat, which I knew that was what it was going to be. I just love my cat so much, so I had to go see him. What was I talking about? Tutorials. So the tutorials are for the new grads / newer clinicians to the company. Results is awesome in that they include their students in it as well. So I was the only student in all 12 of their Louisville clinics for I think the entirety of my rotation with them, except for like the end. There were other students that came in as I was leaving in my last week, but that meant that I was the only student in tutorials for the whole time that I was there, which was honestly very scary for me. Like I really wanted my clinical instructors to like me and to think I was smart. And I used to like study beforehand, and then I still did poorly. But the point was never to like do well in tutorials. It was to go learn. And so I knew that, and I knew that that was the point of like clinical rotations as a whole and like PT school as a whole. But I'm me, and so I just felt this like intense pressure to like do very well. But those were good because they had a specific body region that we were going to be talking about every single time. So one time it would be the hip, then next it would be the shoulder, and then it would be the neck. And we would go through like an evaluation process and talk through it and talk about like what we would want to look for, how we would screen regionally, meaning like the other joints around the joint that we were going to be talking about that day. We would go over some manual therapy skills, and then a lot of it was like stuff that we should already know, or like stuff that people probably had already come across, but then we would also learn new things that the clinicians had, like, for example, just learned from maybe like a course that they had gone to, or some like research that they had read, and like new research that's been coming out since the time that we were all in PT school. So that was really nice because I felt like a lot of it was very new for me. I am someone who, like I said, I worked in a hospital for a year under a physical therapy team. So like I knew a little bit, but like I really didn't know anything going in. And so everything was very new and everything was very like exciting. And so I was always just very grateful to be there, and am still super grateful for that experience. So we talked about my schedule for my first rotation. I guess I'll go ahead and go into highs and lows. My high for that rotation was just the people that I worked with. I really liked everybody. But why I have such fond memories of that rotation is everybody was so nice to me. The people in the second clinic that we went to, we moved clinics 2 months into my 3-month rotation, which means I had 4 weeks left with my clinical instructor within that first rotation. And going to this new clinic, there were a lot more people that worked there, and they were already like an established crew, and like we're all friends, and so they had no responsibility to like be nice to me and like include me in anything, but they did. And even when I moved on to my next rotation, they would like invite me to dinner, and they kept in touch with me, and even now I'm still in touch with some of the people from that rotation. So I just think it was really, really sweet for them to welcome us with such open arms, because obviously they were going to welcome my clinical instructor because he was going to work with them, but the fact that like he was coming with the student that they had never met, that they just like let me be part of their little family for a while, and I felt so comfortable. Laughing and joking around and stuff is very important to me. It comes into the way that I treat and the way that I build rapport with patients, and so the fact that all of these people at this new clinic like built that rapport with me, like kind of from day one, were able to be like sarcastic with me and joke around with me. That was really special. I just really had a lot of fun. My second rotation was at the Blankenbaker Clinic, also in Louisville, same company, different clinical instructor. What was cool about going into that rotation was that I had already met my clinical instructor and I already knew her, because my first clinical instructor was on paternity leave when I first got to Louisville. So I actually started at Blankenbaker for 2 weeks, got to know everybody there, then went back to Jeffersontown, then we went to Okolona, and then I went back to Blankenbaker for 3 months. So I was already comfortable with everybody who worked there, and that was really nice because I was able to kind of just hit the ground running and start taking on patients, and was able to work with the front desk staff and didn't have to like reintroduce myself to anybody. There was a PTA there who, sweetest person I have ever met in my entire life. I know I'm not saying any names, but like, I wish y'all knew her. Anyways, she was the only person I think who was new, who I had to meet, and we started around the same time. And we were both working with my clinical instructor. So that was really interesting because it was this like triangle of learning the whole time, because she had been a PTA for a while and had worked in other settings. And so I got to learn about her experience in those other settings. I think primarily skilled nursing facility, which I've done some like shadowing in, but like don't know a whole lot about. And so it was really cool to hear more about her experience, and especially in terms of like the flow and the schedule is very different. And then just sort of like the goals with the patients can end up being a little bit different, and the way that you eval and diagnose is also different. But it was fine. In my second rotation, the patients that I saw were pretty similar to my first rotation, except that I had this added component of pelvic health on top of it. So lots of patients with hip pain, lots of patients with low back pain, just like my first rotation. But then I also randomly saw like a ton of patients with headaches and jaw pain and ear pain, which ended up being like sort of my favorite body region to treat, and lots of neck pain. And so that was really fun to kind of like identify what is like my current favorite body region to treat. So yeah, patients with headaches, that's like my favorite. But yeah, and so then had some patients with pelvic health concerns. So I had, I think every single one of my patients who came in with pelvic health concerns, whatever those concerns were, had some level of urinary incontinence. I didn't see anybody with fecal incontinence, but with the urinary incontinence, I had patients with stress incontinence, with urge incontinence, and with mixed, which means with both. And then I had some patients with pelvic pain. So some patients had pain with intercourse, and some patients just had general constant, kind of like persistent pain. That was really cool because I got to learn how to do a pelvic health eval. My very first one, my CI was like super nice about and said that I did really well. And so that was really exciting for me, just because it was something that was so new, and I was trying to bring in like what I knew about all my other ortho evals into this like very specific niche ortho eval. I think for me it was really important to get that experience, just because so many people do struggle with that meaning like pelvic health concerns, but like might be too embarrassed to talk about it, or it's definitely not something that I like would have thought to even screen for or think about. But now I think it's something that in my patients with hip pain and my patients with low back pain, or just like concerns in those areas, I think I'll be a little bit more in tune to the fact that like something might be going on with their pelvic floor as well, because those are still skeletal muscles, that's still ortho. And so for me, it kind of like widened my own scope a little bit more. In that rotation, my schedule was very similar. So I think I worked about the same number of hours. For some reason, I always felt so bad about this. I never memorized my schedule for that rotation for whatever reason. I had a little bit of a different schedule from like Jeffersontown or J-Town to Okolona. And so I think that I was like trying to keep up with those. And then for some reason, like at Blankenbaker, I just never learned my schedule. And so I don't know what it was. I could look back through my email, but I like every day would check. And I think it's because I was in like a similar setting, or really the same setting, and working with a lot of people that I still knew. So there was all this like air of familiarity, and I kept wanting to fall back on my first schedule. So I was always just very paranoid that I was gonna miss a day or like come in at the wrong time. And actually that did happen one time where I thought we were, and it, in my defense, it was like I think the schedule was different for everybody that week, and everyone, it was Christmas week, and we were all starting at 7 o'clock the day before, and I for some reason thought it was 7:30 because I think I normally started at 7:30, and so I was the last one in clinic, which like I was still technically on time, but I was like right on that. Like I think I got there at like right at 7, or maybe we were starting at 7:30 and I got there at 8. I don't remember, but I just remember walking in, and the very first person I see was one of my favorite people I worked with, and he just like looks at his watch, and then he looks at me, and I was like, I know, this is the one time I've done this throughout all of my rotations, the one time I've been like close to being late. And I think it was the first time that my patient got there before me, and I just felt very embarrassed and stressed out because everybody else already had their laptops out, and I was just like, okay, I'm gonna go get my stuff and get started for the day. But it was fine. My patient was fine. We didn't get started late or anything like that. And my patient is like the nicest dude ever. And like gave me his card when I was leaving because he like knew people in Florida, and like he was just so nice. I miss him. Anyways, yeah, so I don't know what my schedule was, but it was very similar to my first rotation, except that we didn't have any half days. And the half days were really funny in my first rotation because I had tutorials on Wednesdays and our half days were on Wednesdays. So the tutorial would run from like 7 to 9:30 a.m. And then it would take me like 15 minutes to drive to my like actual rotation site, because the tutorials took place at Blankenbaker. And so I would go to Blankenbaker in the morning for the tutorial, come back to my half day rotation, and start at like 10 a.m. and then I was out by 1 p.m. So I saw like 2 patients, and I barely felt like I had done anything. So I always remember feeling like weirdly guilty the whole time, just because I was like, everyone else has been here since the morning and like has been working and treating patients, and I just like came in, treated 2 patients, and was like, peace out, I'll see y'all tomorrow. It was really funny because I ended up not liking the half days. Like I wanted to be in clinic so bad, and liked being with the people that I was with so much. And this is gonna make me sound like such a nerd and such a liar, but it's so true. I did not like the half days. Like I didn't like, and I think it's because like I didn't have a whole lot to do outside of clinic. Like it wasn't time to study for boards yet. It was way too early. I did study for my rotation, but like I didn't want to get burnt out either. So I didn't study 24/7, and I could like go work out, and then I would like go eat, and then I would blog for a little while, and I would study for a little bit. But then I was like, oh, I just want to be in clinic. Like, I want to be with my clinical instructor, and like he was really fun to be around. And so I was always like a little bit sad whenever we were leaving. And so even on days when I got out early, like my clinical instructor was very good about not like keeping me later than I needed to be there, just to like fulfill some like hourly quota. And so if we got out early and we were done, he'd be like, do you want to go home? And I'd be like, no. And I would always look for ways to stay longer than I needed to. And like, it never really worked out because there was never anything for me to do. So then I was just like, fine, I'll go. But I didn't like it. I liked being there. And I know I sound like a liar when I say that, and I know I sound like I'm sucking up, but like it's the truth. And I would 100%, like if I could start working there again tomorrow, I would go back. Anyways, back to my second rotation. Did I do my highs and lows already? Oh my gosh, I didn't do my highs and lows. Hold on. I really don't remember. Oh, I did my high. I did my high. Oops. Let me go back. This video is all over the place. My low for my first rotation is... Here I start talking about how my housing situation was one of my lows for my first rotation. Watching this back now, I'm realizing that my true low for that rotation was locking my keys in my car trunk, missing my CI's presentation on direct access, and then my second CI having to come bail me out and essentially save my life that night after like 3 hours of being stuck in the parking lot of my first rotation site. I won't get any more into it now, but I cannot believe I forgot about that the first time around. I had a very weird housing situation. That was entirely on me. I was in a housing situation that like wasn't the best for me, and it was at like 7:30 in the morning on a Friday that I realized that I wanted to change my housing rotation, and I was at clinic when all of this was happening, and was like making phone calls to apartment complexes being like, please take me for 3 months. My clinical instructor was like so nice about it, and he never was like, hey, you're in clinic, like you have patients about to come in, you need to focus, like this is not the time to be figuring out your housing. And he even let me out for like 2 hours one day to go like pick up my new keys and like I think finish signing my lease or whatever I had to do. So that was really great. But yeah, so just housing was kind of a stressor, and then just living by myself in general was a really big stressor for me. I definitely consider myself an extrovert, and so for me it was really fun to come into this new environment with all these new people, but I like having my like family or friends to fall back on. And so I think that I can like make friends if I need to, but not somewhere where I'm gonna be for such a short amount of time. And so for me, that was really difficult to like try and make friends at the gym, or like try and like I went to cycling, and so like people were super nice there, but I was like, I'm probably never gonna see you again. And so that was really stressful for me. And so like living by myself was really hard, because I have lived away from home since junior year of high school. And that was at a boarding school, and my roommate there remained my roommate throughout the entirety of college. And then during my master's program, I had a roommate, and then I lived at home for a year. And then in PT school, I had a roommate for 2 years. So I've never not had a roommate. Like I've never not lived with somebody. And it was very difficult for me to live by myself, and it was very lonely, and I overthought everything all the time. And then I would get super upset. And so housing was my low. Okay, second rotation. My high, it feels like a cop-out to say the people, but I really was comfortable with those people. I have a lot of issues with like eating in front of people sometimes, and then I get very like self-conscious about my body, and just struggle with that a lot. I didn't really have that many struggles in my second rotation, and I think that one, it was because of the familiarity of it all. I was starting to get more experience in outpatient ortho, and so I was starting to find my place a little bit better. I felt a little bit less awkward doing evaluations and coming up with interventions on my own. I felt more independent, but I also knew everybody, and everybody was really good. Again, just like my first rotation, about like joking with me all the time, and like listening to my stupid jokes, and like pity laughing when they needed to and when I needed it. For me, that was an environment where I just felt like I was like amongst friends. It definitely lessened the just like general anxiety that I feel in life a lot. My low, again, it feels like a cop-out, because these are lows that are like about things other than clinic, but that rotation took place November through like mid-January. The days were shorter, and I just didn't feel good. With the days being shorter, I never felt like I had the time to work out, even though I probably did. And so then I stopped working out, stopped cooking as much. So then I started eating out more. I started to gain weight, and like that made me really anxious, because I do struggle with like disordered eating and body image issues. And I just felt this like stress all the time. And again, like going home to no roommate, and then being like, now what? And so like having the time to work out and to cook and all that, but not taking it because it was dark outside and like the weather was very gloomy, and then wasting all that time and like trying to find other things to fill the time, and then just like going to bed at 7 p.m. sometimes, because I was like, what's the point? And so that was really hard for me. I didn't do a great job of taking care of myself, even though I was going to counseling. That was really the only thing I was doing for myself at that time. And so if I could go back and do it again, I would do a much better job of taking care of myself outside of clinic, because I did have good relationships with people inside of clinic. And so I wish that sort of that energy would have carried over outside of clinic. And I am glad that like I would get lunch sometimes, or get dinner sometimes with people from both my first and second rotations. And so that was always really helpful for me to fill that time and to be around people, and to be around people in an environment where I wasn't like stressing myself out and psyching myself out about like imposter syndrome and wondering if I was doing the right thing with my patient, and just to be able to relax and not have to worry about like documentation or things like that was really good. But yeah, the weather and just winter time, just the way life works with shorter days. Apparently that was a low for me. Apparently I can't handle that. My third rotation was Jacksonville, Florida, with Brooks Rehab, which already has like a really great reputation. So the reason I chose them was not necessarily because I wanted to work in inpatient rehab, but it was because my professors were like, oh, Brooks Rehab is a really good place to go. You should choose Brooks. I'm very glad that I did. Those clinicians are on it. Like they love their patients, and they take such good care of them, and they are so stinking smart. So my schedule for that rotation was way different from my first 2 rotations. Working in a hospital, I had actually 2 clinical instructors at the same time. So in my first 2 rotations, it kind of felt like I had 2 clinical instructors just because I already knew my second clinical instructor. My first CI and I had a good relationship, and so I felt like I had 2 CIs at the same time because I was in the same city. But now I was in a different city, but again with 2 CIs. So they split their schedule and they split their patients, and they each did 3 12-hour shifts. So they kind of left it up to me, and in the beginning they wanted me to work every single day, Monday through Friday, but then as I got into it, they left it up to me as to whether I wanted to come in every single day and like shadow other clinicians during the days where they weren't working, or if I wanted to work 3 12s with them. They also wanted me to work a couple of 12-hour shifts just so that I could get a sense of what it was like. A 12-hour shift allows you to see every single patient in that day, as long as the patient is like willing to work with you, obviously. But in an 8-hour shift, you wouldn't necessarily get to every single patient because some patients were booked multiple times, like in the morning and then like right after lunch, and then some of the other patients weren't booked until later in the day, either because of like the nature of what we needed to get done with them, or because they just like preferred a later time. And so there were certain patients that I like didn't see for a really long time unless we tried to like pick them up because another patient refused or was in some sort of like procedure and couldn't work with us. In the beginning, I worked every single day because that way it gave me some continuity and I wasn't going multiple days in a row without having seen any patients and thus forgetting what was happening. Patients in inpatient rehab make progress and their status can change very quickly. So missing a day or 2 in the middle of working with them can be a really big deal, and you can miss a lot. Versus an outpatient ortho, you're probably not missing a whole lot, and you're not seeing patients every single day in that setting, of course. And so being in this setting and seeing patients all the time and multiple times a day, that was a huge challenge for me just because I constantly had to be coming up with what I wanted to work on with them. And I think for me, like I would get through a treatment session with a patient and then think, whew, I did it. I came up with a good intervention and like a good treatment session and like I did a good job. And then like 30 minutes later, I needed to see that same patient again. And so I was like, shoot, what now? We just did a bunch of upper body strengthening and they're gonna be really tired because we just worked on it. So like now what can I work on? Like what is something that we can work on with this patient that is directly going to be related to the goals that they need to accomplish to go home or go to like a skilled nursing facility or just like elsewhere, because insurance only covers a certain duration of stay in inpatient rehab, so they couldn't be there forever. So yeah, so schedule was pretty unpredictable week by week. I really liked it because it kept me on my toes, it kept me engaged, and I never got bored with the schedule. But for that reason, I definitely didn't memorize that one because there was no set schedule. It was always just kind of like texting back and forth with my CIs, trying to figure out like which CI I would be with on what day. Was I working a 12-hour? Was I working an 8-hour shift? Was I shadowing elsewhere? And that was really cool because I actually did get to shadow elsewhere. So I got to shadow an outpatient neuro. One was called like the SCI day program. So it was our patients going from, which I just realized I didn't tell you what populations of patients I was working with, but primarily patients with spinal cord injury. And so that was a program that they might go into. And then also just like a general outpatient neuro, they were both on the same floor and they were on the first floor of the hospital that I was already in, so I didn't have to go anywhere else. I could just go downstairs, and that was where I got to shadow for a day. So patient populations, I was primarily working with patients with spinal cord injury. Some of those same patients had had strokes, and also we just worked with other patients who had had strokes. Pretty much all of my patients had blood pressure issues. Some of my patients had Parkinson's. I worked with a couple of patients with traumatic brain injury, and even the spinal cord injury, some of my patients, their spinal cord injury was traumatic, some it was not. And so there were, just like an outpatient ortho, there were patients with lots of different diagnoses, but for me, it all felt so new. Cardiopulm, I had already done a short-term rotation in, and so I felt a little bit acquainted with that side of things. But the neuro stuff, like for me, neuro was always my weak point in PT school, and I knew that. And so like I tried to study going into it, but boy, no studying could have prepared me for how just like, not lost. I was gonna say lost, I would feel. Not lost, but just like overwhelmed by how new everything was. And I think for me that was difficult as a third year in her last rotation, feeling like I should be ready to just go in and start treating and I should be at entry level already because time is running out and I'm about to graduate. But my clinical instructors did a really nice thing for me, which was to constantly reassure me that this is a tough rotation and patients with a lot of neurological issues in an inpatient setting also have a lot of other things going on. And they also then have the psychological component, which every patient has, and you have to kind of address that and keep that in mind while you're addressing all these other things. And a lot of patients are in pain or limited by a lot of other comorbidities, and so you can't always just jump right into an exercise. Sometimes the entire treatment session is spent getting the patient out of bed and helping them to do that and helping them to problem solve through that. And so the treatment sessions were way slower than I was used to in outpatient ortho, where it was like exercise after exercise after exercise. And there were times where I could like walk away from the patient and like go get a drink of water or talk to my clinical instructor about something like while the patient was doing an exercise. But an inpatient, you couldn't do that. A lot of times I was like very closely guarding my patients while they were walking because they were a high fall risk. And so communicating with my clinical instructor and like problem solving was very different in that setting. I still had plenty of time to do it, but yeah, it was definitely like just a big change. And they constantly reassured me that it was just different. It didn't mean that I was stupid. It didn't mean that I couldn't one day get to entry level in that setting. It's just that I wasn't starting at that point and it was going to take time. So that one was supposed to be 12 weeks. I ended up struggling with something in my personal life that had nothing to do with that rotation, but that did play into my sort of like emotions and my ability to be in that rotation and feel like I could be there 100% mentally. So I ended up only staying 7 weeks in that rotation. My clinical instructors were the absolute best. Like I said, it had nothing to do with that rotation. And on my last day there, my clinical instructor kept trying to convince me to stay, which was a huge compliment. That made me feel so happy just because I absolutely love her. She was hilarious, but also because I constantly felt guilty that I was like holding them back. These are clinicians that are like experienced and like she had done a residency at that location. And so she like knew what she was doing. And as a student, I was like, man, I'm holding her back. Like I'm slowing these sessions down. I'm asking a lot of questions when she could just be treating like she wants to. And so the fact that she asked me to stay was just super sweet and made me feel like, oh, they maybe do want me here. Which they did. They were awesome, like I said. And they have a lot of students coming through. So like I said, at Results, I was the only student at the time. That's just kind of like how the timing worked out. But at Brooks, they have a constant kind of stream of students going. So I met a ton of other students. I actually had 2 of my classmates there with me on the same floor, which is really nice because to have that familiarity component was really important to me because I was moving to a city where I didn't know anybody. That was the same for Louisville, but my parents lived only 2 hours away from Louisville, so I could go home on the weekends. But when I was in Florida, I did not know anybody there. And so to have some classmates there was really nice. And then I met a bunch of students from 2 different programs down in Florida. And they were all super nice to me too. So it was nice to feel like I wasn't alone. I just realized I never actually wrote down my highs and lows for this rotation, but I'm gonna try to just do it on the fly. I think my high was just all the different experiences where I had like little wins. So I hadn't like guarded a patient since second year, which was a year before that in that like short-term rotation that I did at Duke Hospital. And so I was very nervous and I was very scared that my patients were gonna fall. And just being able to have a ton of reps with patients and to have my patients trust me was very nice. And I think one of the biggest compliments that I've gotten from patients in my second and third rotations was when they would say, oh, I didn't even realize you were a student, or oh, I always forget that you're a student. That always made me feel really good because it made me think not only like, might I actually know what I'm doing just a little bit, but I'm coming off like I know what I'm doing. And that's important for building that trust, because if I had a provider who was like very skittish and like looked terrified all the time and like didn't have confidence and didn't seem to know what they were doing, I would not trust them and I probably wouldn't do the exercises they gave me, and I would probably be very nervous to like try anything new, especially if I had had like a spinal cord injury and then was like relearning, and to then have somebody who like didn't have confidence trying to help me when I was already nervous about like falling. That would be bad. So that was really nice that I felt like I was not only building confidence, but that some of it was coming across to my patients and hopefully to my clinical instructors. So that was really cool. But yeah, so high was just being able to not only be in a neuro setting, which was something that I was nervous I wouldn't get to do, but I knew that I really, really needed because it was a weak point for me. I think it'll be helpful for me on my rotations, but I also got to see just like a ton of patients in that time and a ton of patients with a lot of different diagnoses. So like I said, patients with spinal cord injury, patients who had had strokes, patients with Parkinson's. I got to see, again, like another really nice age range in that time. So a lot of our patients who had had traumatic spinal cord injuries were a little bit on the younger side. And then we'd had some patients who had had like atraumatic spinal cord injuries, like from an infection, who were like more like mid age range. And then we had some older patients with Parkinson's and just a lot of patients who had had falls. that had then caused their spinal cord injury or had then caused traumatic brain injury or other issue. My low for that rotation is just that I was dealing with other things outside of it that made it so that I didn't feel like I could be 100% in it. I also feel like it was a little bit of a low for me. It's easy for me to like regret this now and to like look back and have 20/20 vision on it, but, or what's called hindsight. Oh my God. Stupid. I do think that like everything plays out the way that it's supposed to and like everything happens for a reason, but I wish that I had made the decision to switch my boards from April to July sooner so that I could have been just like 1,000% mentally in that rotation. I did my absolute best. Especially when I was there, to be like very present and to study outside of the rotation and to plan for my patients outside of the rotation. But I think that my patients would have benefited more. I think I would have done a better job had I not been studying for boards at the same time, because unless my board study material was the exact same as the patients I was going to be seeing the next day, that was taking time away. I will say that my schedule was really nice for that rotation in that I was out by like 2 or 3 every day if I was working an 8-hour day because we started so early. And so it did give me some time to both plan for my patients and to study for boards, but I think it was just unnecessary extra work because I didn't have like a job lined up. I didn't have a residency yet after graduation, so I didn't necessarily need to start working like day 1 after graduation, and I could have taken a little bit of extra time. So honestly, it was a very, very, very difficult decision for me to switch my boards from April to July. It wasn't just like this is kind of a lot of work, let me switch it. Like I really didn't want to, and I really wanted to take my boards in April. But with just like all the other things happening in my life, I talked to my program and it just seemed like a good decision to take it in July instead. And honestly, now the situation that we're in with like COVID and everything, like really didn't matter just because the April boards are being postponed for a lot of people. And so maybe everybody, I haven't totally kept up with what's going on. So now it's kind of easy for me to be like, okay, well, it's fine that it was in July. But at the time it was a really difficult decision. And at the time it didn't really seem like something that I was gonna be open to, and it wasn't really a consideration for me at the time. So a little bit of a low for me that I wish I had realized that sooner, and I wish I had been even more so present and just like had done a better job overall. I think 7 weeks in a rotation is a long time to be somewhere, and I think I could have gotten further along in that time, and I definitely think I could have gotten further along by the 12-week mark. But overall, really good rotation. And like I said, my clinical instructors were brilliant. My classmates as clinical instructors were super brilliant as well. And so I got to learn from them too. So just like really, really, really strong learning environment in addition to treating at the highest level. And the patients always like loved the therapist. Oh, and I got to work with so many other healthcare professionals. So I got to especially work on my communication with physicians. So I didn't talk to a lot of physicians in my first 2 rotations, even though I did get to participate in like marketing type stuff and like going out and talking to physicians in the community. This time, these were physicians who were like right there with me treating the patients. And so I got to work on my communication with them and like improve my confidence in that way. And then got to work very closely with the occupational therapist, and then of course the nurses. And then there would be other types of healthcare professionals there as well. And that's where my 1-year experience in the hospital really came in handy, because I felt like that was an environment that like I was starting to understand. Like I felt like I had a good grasp on certain things that like you have to do in inpatient that are very different in patient care from outpatient, like helping a patient go to the bathroom, things like that. Like I said, I was very worried about dropping a patient and a patient like falling. And so that part was definitely very new for me because where I worked in the hospital before, my patients were a fall risk, but like lower-ish fall risk. And so I never had like significant concerns there, but in this rotation, definitely it was like a step up from everything I had already done. But yeah, that was definitely a high for me as well. Just like all new things. I asked y'all on social media if you had any questions for me about my 3 rotations, and here are some of the ones that I got. The very first question someone asked me was, what was your favorite rotation? I genuinely learned a ton at all 3 of my rotations, so this is absolutely no shade to anybody. And I loved all of my clinical instructors, and I think that they all just put so much time and energy into me that I was always blown away by how much they were willing to help me, not only in clinic, but also outside of it. But I think that the fact that I was starting so fresh and like knew nothing, I give my first clinical instructor a lot of credit for kind of building me up from the ground. And we were kind of starting from scratch with a lot of things. And I think it just being my first rotation, I didn't have a whole lot of like clinic specific imposter syndrome yet to battle. And so it was a very tough rotation for me mentally, just because there was so much that I didn't know and there was so much that I had to learn. But yeah, my first rotation, I think that was kind of where the type of clinician that I was going to be was like well established, and that is just like where this whole journey started. The short-term rotations were awesome too, and I guess I'm not really counting those in this because I hadn't had all my coursework at that time. I personally just didn't feel ready to start treating, and so for me, I think my biggest improvement was in my first rotation, again starting from like not wanting to do an eval ever at all and like refusing to do the very first eval that my clinical instructor asked me if I wanted to do, to then wanting the evals and wanting the more complex ones, just starting to fall in love with the way that I could learn to incorporate all the like mental health awareness and just like paying attention to that and factoring that into the way that I treat while also learning all the ortho stuff. For me, that was really important. And yeah, I think most of my improvement was made in that first rotation. I just really love that rotation. It holds a special place in my heart. And then, like I said, my clinical instructors have done a ton for me. So even when I was there, both of my CIs in Louisville helped me a ton. Outside of clinic with what I was struggling, they are the ones that helped me find counseling in that area. And then my 2 CIs in Florida also knew that I was struggling just mentally with like life and helped me a lot. And then they gave me like a bunch of resources to help me outside of clinic, just because I was so new to this inpatient rehab neuro world, and that helped me a lot too to get smarter faster. But yes, like I said, loved all of my rotations. I got very lucky with all 3 that I got, and then I got very, very lucky with all 4 of my long-term rotation clinical instructors, and then my clinical instructors, the 3 of them for my short-term rotation. So I have nothing bad to say about any of them. It was a fantastic year in terms of learning a lot, meeting just the coolest patients ever, and spending time with my clinical instructors and getting to know like their teaching styles and them getting to know me, and then us figuring out like how do I become the best clinician that I can. But yeah, someone asked me what I'll miss most about PT school. That's a great question. I generally just really like being a student. I like having mentors. I know that having mentors is not something that's ever going to go away. And especially as a new grad, I think that, you know, depending on where I end up working, I could end up actually having mentors who are like assigned to me. But there's just something about being a student where like people really take you under their wing and are just so protective of students. So even when you go to conferences, clinicians and academicians and like basically anybody who's not a student will be very attentive to like who the students are and like get them into events that you have to pay for free and like help you out by giving. Like I've accumulated so many business cards over the past few years just because everyone wants to help, and I'm excited to graduate and to hopefully become a clinical instructor soon in my career so that I can then hopefully do that for other people, because I think that the clinical instructors that I've had, the faculty members that I've had, everyone has just been so much on my side, and that's been true for a lot of my classmates. And I think I'm in general just gonna miss just being a student and just having that like grace of like, it's okay that you're a student because you're still learning, and just everyone being so understanding of like, you're gonna mess up a lot, but like I'm here for you and like how can I help you to grow. One thing that I didn't talk about is where I went after that Florida rotation ended. So I ended at week 7. My classmates all ended there at week 8 because of COVID. But in that 1 week interim, what was actually planned for me was one last rotation at Duke. I was supposed to be an outpatient ortho again with some of my favorite PTs at Duke, and was going to be primarily treating patients who had persistent pain, which for me again is like something that is definitely a passion of mine and is something that I'm going to look for in a job. I was really, really excited about it. It was supposed to be a 4-week rotation. So I actually moved to North Carolina for a couple of days. I stayed with a really good friend of mine who I've met through like conferences and networking and stuff. So it's definitely super important for things beyond just like getting a job. Now I have a really good friend out of it and like a 2-day roommate. So I moved to Durham and stayed there for 2 days. I got there night 1. I unpacked some of my things. The next morning we got an email saying that our rotations had been canceled for our own safety and that we would not be going back. So that meant that I was not going to be starting that 4-week rotation. So I never did. And I was definitely really, really bummed. I knew it was going to be really good. I was really excited about it. It was in my ideal setting. It was with someone who I had like wanted to be my clinical instructor for a really long time. It was something that I was excited about, but like I said, I personally think that everything happens for a reason. Maybe there was a good reason why that rotation never started. But I did drive the 8 hours from Florida to North Carolina. So that day I told my friend that I was probably gonna go to Indiana, stay with my family, just because that was somewhere I was comfortable. That way I didn't have to unpack all of my things in North Carolina. And then if there were to be any other sort of like lockdown or travel restrictions put into place, I wouldn't get necessarily like stuck in North Carolina because we were all in a little bit of a limbo of what was gonna come next. But that night, my friend threw me a graduation because we had a feeling that graduation was gonna be like canceled or postponed, because with the rotations being canceled, we knew that there probably was a good chance that within a month, we weren't necessarily going to be having this like big graduation ceremony where a bunch of people were going to have to be together in the same room. So she bought me sushi burritos to be exact, and then she threw me a graduation. So she asked me if that was the best graduation of my life. And I can honestly say that was the best doctoral graduation I've ever had. No, it was totally the best graduation of my life. Fun fact, I hate graduations. No one wants to sit there and like be really hot and then listen to a speech by someone that you're probably not gonna remember. And I had really like famous speakers come for my high school and my college graduations, and like I don't remember anything that they said. Anyway, so she threw me a graduation in her living room. The video is under my Instagram TV, the IGTV videos on my Instagram, so you can go check it out there. So it's just us two in her living room. I'm wearing her doctoral robes and wearing her pillow on top of my head as my cap, and I just like walked back and forth in her living room a couple of times, and then we shook hands, we danced to Vitamin C's Friends Forever, and then we ate a bunch of sushi, and it was the best night of my life. So yes, that was the best graduation I've ever had. One question that I just got was what I wish I had known before I started my rotations. I think that's a great question. It's definitely a question that I asked a lot of now new grads, but like third years at the time when I was a second year. I'm trying to remember what they told me. I think that some of them had said not to start board studying too early and not to like burn yourself out. A lot of them just gave a lot of really good encouragement about like, you don't have to know everything. You don't have to be perfect. There's no such thing. This is just like a learning opportunity and to just like make the best of it. I wish I had known just how much it would affect me to not be living with anybody. And I wish I had known better coping strategies for feeling that loneliness, because especially on days where I didn't feel like I was doing well in clinic, that loneliness hit really hard. And it was why I loved being in clinic so much, I think, because I felt like I had like a mini family or like friend group around me with the people that I worked with in clinic. And I wish I had considered, I mean, I don't know that I would have done necessarily anything differently. I don't think that I would have lived with anyone just because I didn't know anybody. When like either going to Kentucky or to Florida. But I just wish that I had been a little bit better prepared, just because I do consider myself such an extrovert. And I think I thought that it would be easier for me to just go out and like make friends, but time is limited on these rotations. And some people were doing long-term rotations for 8 weeks. Ours were 12 weeks. Some people do them for 6 months, but even 6 months was way too short for me. I wanted to stay there longer. I had a really hard time leaving. And so it's difficult to make friends, and like making friends is not necessarily everybody's priority on these clinical rotations, but for me it is something that's really important, and being comfortable around the people that I'm around is something that's very important for me to feel comfortable then being 100% the clinician that like I feel like I can be. And so that's why like knowing who I'm going to be working with is really important for me when I start looking for a job, and that's why I think I just loved being with Results so much, was because I loved everybody who was there. So yeah, so I wish I had known just how to better cope with the sort of inevitable loneliness that my like loudmouth self was gonna feel. I don't know that I necessarily have much better coping strategies now, but I do think that like FaceTiming my friends and family all the time helped a lot. And I think that maintaining a workout routine and just maintaining a routine in general was really important for me in the beginning, because that helped me to establish some sense of like normalcy in this very like chaotic sort of newness of it all. But once it got late into my second rotation, routine was a little bit too familiar. And so I found that I was going through the motions, even when I was like going on runs and stuff, like things that helped me to break up the monotony of like the stress that I feel sometimes when I was like working out and things like that. Like I was just going through the motions, and I wasn't like excited about my workout anymore. And I was just like stressed about, was I doing well enough in clinic? Did people like me? Which like shouldn't have been a stressor by that point. But it's just like kind of the nature of how I am. And so at that point, I like completely abandoned my routine, and I started doing just like all these different things. So I like went to different workout classes for like things that I had never done before. And I started like calling friends that like I hadn't talked to in a really long time. And I started like doing a lot more like hands-on like craft stuff that I hadn't done in a long time. And like going for walks, even when it was cold and dark outside, and just like trying to vary things enough to where I couldn't just go through the motions, because I had to think about them more. So blogging, it changed for me a lot. And like I changed the way that I was like making videos and like writing. And so I think changing up my schedule and trying new things helped me to be focused on those things and not be so focused on the fact that like my friends weren't here, my family wasn't here, and that my clinic time was ending, and that my rotation was coming to a close. And so it helped honestly to just like kind of keep me distracted. And I think distractions helped me a lot, because there was no way that I was going to be able to totally establish a new life in this new city when I knew that I was going to be moving on to a next one. And even in Florida, like I knew I was only going to be there for 3 months. And so I knew I was going to have to leave soon. And so I think for me, that was just like a really difficult part of being by myself. And I didn't realize that like I didn't know necessarily how to be by myself and be totally comfortable with that 24/7. All right, thank you all so much for watching and just for listening to me ramble for forever about my clinical rotations. I miss my CIs a lot, and I miss everyone else that I worked with. And I just really miss being a student and being in clinic and learning and working with patients. And so I know that I need to have patience in this time, and that one day I'll get back to treating patients, and I'm really excited, but it won't be as a student, and I won't have a CI. And so I just really, really appreciate all of my clinical rotations, my short-term ones and my long-term. And I've definitely learned a lot. I know a lot more about what type of clinical instructor I want to be now. And I'm just so excited for that next phase in my life. But yeah, so thank you all so much for watching. If you have any more questions about my clinical rotations, like I said, I'll probably do a few more videos. I have some blog posts coming up about my third year and about my rotation specifically. So do be on the lookout for that. But yeah, thank you so much for tuning in, and I will see y'all in the next one.